Fibrothorax, a condition where the lining of your lung thickens and scars, restricting its ability to expand and function properly. Imagine your lung trapped inside a cage of scar tissue. That's essentially what happens in fibrothorax. It's a serious condition that can significantly impact your breathing and overall quality of life. Let's delve into the details of this respiratory challenge. So, what causes this cage to form around the lung? Fibrothorax usually develops as a consequence of other conditions that irritate or inflame the pleura, the membrane surrounding the lungs. Common culprits include infections like empyema, which is a collection of pus in the pleural space, or tuberculosis, bleeding into the pleural space, known as hemothorax, often from trauma, can also lead to fibrothorax. Other potential causes include asbestos exposure, certain medications, and autoimmune diseases like rheumatoid arthritis or lupus. Now, let's understand the process behind fibrothorax. When the pleura is injured or inflamed, the body tries to repair the damage. This repair process involves the deposition of fibrin and collagen, the building blocks of scar tissue. Over time, this scar tissue thickens and contracts, forming a dense, fibrous layer. This layer essentially encases the lung, restricting its expansion during breathing. The trapped lung can no longer fully inflate, leading to reduced lung volume and impaired gas exchange, ultimately causing breathing difficulties. Fibrothorax isn't a widespread condition, but its exact prevalence is difficult to determine as it often arises from other underlying illnesses. We know that individuals who have experienced empyema, hemothorax, or pleuritis are at a higher risk of developing it. Populations with high rates of tuberculosis also tend to have a higher incidence of fibrothorax. Occupational exposure to asbestos, although decreasing, remains a risk factor in certain areas. The symptoms of fibrothorax can vary depending on the extent of the scarring and the lung's functional impairment. Common symptoms include shortness of breath, which can worsen with exertion. Chest pain or discomfort is also frequently reported. Individuals may experience a chronic cough, often dry or producing only small amounts of phlegm. In severe cases, fibrothorax can lead to cyanosis, a bluish discoloration of the skin due to low oxygen levels in the blood. Diagnosing fibrothorax typically involves a combination of imaging and clinical evaluation. A chest X-ray is often the first step, which may reveal thickening of the pleura and a smaller lung volume. A CT scan of the chest provides more detailed images of the pleura and lung tissue, allowing doctors to assess the extent of the scarring. Pulmonary function tests, such as spirometry, can measure lung capacity and airflow, helping to determine the severity of the respiratory impairment. In some cases, a pleural biopsy, where a small sample of the pleura is taken for examination, may be necessary to confirm the diagnosis and rule out other conditions. While there aren't distinct types of fibrothorax in the traditional sense, it can be classified based on its extent and severity. Some cases may involve localized areas of pleural thickening, while others can affect an entire lung. The severity is often graded based on pulmonary function test results and the degree of respiratory impairment. The primary goal of treatment for fibrothorax is to improve lung function and alleviate symptoms. Mild cases may require only supportive care, such as pain management and pulmonary rehabilitation, which includes exercises to strengthen respiratory muscles. More severe cases may necessitate surgical intervention. A procedure called decortication involves surgically removing the thickened pleura, allowing the lung to expand more freely. This can significantly improve lung function and quality of life. In some instances, pleurectomy, the removal of a portion of the pleura, might be considered. Minimally invasive approaches, such as video-assisted thoracoscopic surgery, are often preferred when feasible. Preventing fibrothorax largely revolves around promptly and effectively treating the underlying conditions that can lead to it. Early and aggressive treatment of empyema with antibiotics and drainage is crucial. Similarly, prompt management of hemothorax and pleuritis is essential. Avoiding exposure to asbestos and managing autoimmune diseases effectively can also reduce the risk of developing fibrothorax. The prognosis for individuals with fibrothorax varies depending on the severity of the condition and the effectiveness of treatment. In mild cases, with appropriate management, individuals can often maintain a reasonable quality of life. However, severe cases can lead to significant respiratory impairment and reduced life expectancy. Surgical intervention can often improve lung function and quality of life, but it carries its own risks and is not always successful. Recent research is focused on developing less invasive methods of removing the thickened pleura and on identifying biomarkers that can predict the development and progression of fibrothorax. Studies are also exploring the potential of anti-fibrotic medications to slow down or reverse the scarring process.